Good morning, everybody. Thank you so much for being here. My name is Jackie Cornell. I serve as the Executive Director of Planned Parenthood Action Fund of New Jersey. We are fortunate to advocate on behalf of the Planned Parenthood affiliates here in New Jersey who operate 22 health centers throughout our Garden State, and we provide care every year to over 130,000 patients. At Planned Parenthood, we strive for a world where everyone has access and resources to make the best healthcare decisions for themselves, their lives, and their futures. In that world, everyone, no matter where you live, your income, your immigration status, your insurance availability, your identity, has the resources, information, and again, access to a wide range of sexual and reproductive healthcare services. Right now, we know that that vision, unfortunately, is quite far from reality in too many states across the country. Reproductive freedom is under attack, and that is not hyperbole. Since the fall of Roe v. Wade in June of 2022, 21 states around the country and counting have banned or extremely reduced and restricted the access to abortion. In those states, millions of Americans are forced to travel far from home to states where reproductive freedom is championed, like right here in New Jersey, or go without care. Millions of Americans no longer have the right to make their own personal health care decisions. And we have heard horror stories from around the country of folks being told to wait until they are in crisis before doctors will intervene. That should alarm all of us. However, here in New Jersey, our leaders have forged a different path. Leaders like Governor Murphy and the First Lady. We're joined by so many amazing dignitaries from throughout government. Our new Lieutenant Governor, Tanisha Way, Department of Health Acting Commissioner, Caitlin Baston, the AG is here with us. Matt, thank you so much, as well as several members of the legislature who I'll address in a second for being champions. We have Senator Turner here with us who has worked so tirelessly on this issue that we're about to talk about today. Assemblywoman Verlina Reynolds-Jackson and Assemblywoman McKnight. Thank you all so much for being here and being part of this incredible, incredible work. We have fought here in New Jersey to protect our rights and improve access to a full range of reproductive health care. That includes abortion care, as well as preventative services like cancer screenings, testing and treatment for STIs, and birth control, which we're going to talk more about. The list of recent successes here in New Jersey is absolutely incredible. Through the First Lady's Nurture New Jersey program, we've seen increased access to Medicaid for new mothers and have been steadfast in addressing the disparities for Black and brown women in receiving care, especially in that often fraught fourth trimester after giving birth. New Jersey has codified the right to abortion into state law, and I might add that this is one of the strongest laws in the entire country. We have passed legislation protecting all patients, even those who come from out of state to receive care here, as well as providers of abortion care here in New Jersey. The Department of Banking and Insurance has addressed disparities in insurance coverage for abortion care, and our governor and our legislature have invested historic funding into reproductive health care services, as well as championing new funding, in addition to those increases, towards facilities, training, and security for abortion providers. And of course, as we're here to discuss today, we've broken down barriers to contraception through legislation to permit birth control availability over the counter. Increasing access to birth control is especially important in light of the overturning of Roe v. Wade. A Guttmacher Institute report from 2021 states that 90% of sexually active women will have used birth control at some point in their lives. For individuals to have the ability to make their own healthcare decisions around whether and when to become a parent, birth control must be accessible and affordable. Allowing birth control to be available over the counter breaks down a major barriers that many individuals face. Now, without the burden of needing to take time off of work or arrange for childcare or transportation to make a doctor's appointment, individuals can safely obtain a method of contraception that works for them at their local pharmacy. This increases a person's ability to take birth control consistently, and it's that consistency that leads to fewer unintended pregnancies and overall better healthcare outcomes. We look forward to working continually to address patients' needs here in New Jersey and increase access to all who come to our state to receive care. Again, I want to highlight and thank, there are several members of the legislature who worked on S-275 who aren't with us today, Senator Vitale, Assemblywoman Timberlake, and Assemblyman McCurgy as well for their efforts. I'm incredibly proud to lead Planned Parenthood Action Fund of New Jersey in this time and to live in a state that stands firmly in support of everyone's ability to make their own personal decisions around their health care. As we continue to face a reality where our rights and freedoms are under attack across the country, New Jersey continues to be a beacon of hope for all, and I'm so proud of the work we've done here today. We would not be here in so many ways without the great leadership of the governor. He has prioritized reproductive health care and women's health care since even before you came into office. And so we are just so delighted to be here with you today, and thank you, Governor, for all you've done.
Jackie and I go way back, including as a former colleague, so it's great to be with you, and thank you for that rousing call to action and for your leadership of Planned Parenthood Action Fund of New Jersey. Before we jump into, or jump back in, I should say, as to why we're here today, just to state the obvious, this has been a devastating week in the world and in our state. From the earliest moments on Saturday morning, right through to a minute ago watching CNN, and unfortunately I suspect this is going to go on for a long time, the absolute barbaric slaughtering by Hamas of innocent Israelis, and by the way, it turns out innocent Israelis and many others, including Americans. It has touched our country. It has touched New Jersey. There is reported one loss of life. We have not been able to confirm that yet. We know that there is at least one missing, Aiden Alexander, Bergen County. I've got no update on his whereabouts, a member of the IDF. I spoke to his mom and dad the other day. We know that there are a number of folks who are in Israel, stranded, if you will, who we're trying to work with Matt and federal authorities and our Homeland Security people to get them safely back home. I've been in communication with the acting consul general of Israel beginning Saturday, was with him last evening. We have lowered the flags in memory of the innocent lives lost, an overwhelming number of Israelis, but also there will be, and there are innocent lives lost of others, including Palestinians. Let's not forget that we have not just one of the largest Jewish and Israel-American communities of any American state, but we have the largest Palestinian state. And putting aside the horror, the brutality of Hamas, which must be brought to justice and eliminated, there are millions of innocent folks out there of all denominations, of all backgrounds, who bemoan this loss of life. As best, and by the way, myself, Tammy, Matt, Tahisha have been up and down the state at seemingly one vigil after another, as well as other members of our administration. As far as Tammy and I can piece this together, we know we spent a magical afternoon in July of 2016 in what we believe is the kibbutz that was absolutely ravaged, including the reported beheading of precious little kids. We think we were there, and whether we were there or not, frankly, it's just an awful, awful act of barbaric violence by these awful people, and they must be brought to justice. There's no two ways about it, but please, God, we protect as many innocent lives, Israelis, Palestinians, and others, and that they may not be caught in this rightful, I might add, rightful assault on Hamas to eliminate them, period, but certainly to eliminate their war-making abilities. Again, when you're in my position, when you're in Matt's, Tahisha's, Tammy's, all of us, and you are the head of a state that has the concentration of Jewish Americans, Israeli Americans that we have, this is something that is and will remain top of mind and top priority, I suspect, for a long time to come. Please keep all of these victims all of the innocent victims in your prayers, their families, their friends, the folks who have been taken hostage and their family and friends. You speak to the Alexanders as I did, or any other family that has either lost someone or can't find someone or they're injured. The heartbreak is just overwhelming. So God bless them all. Again, back to why we're here. Jackie, again, thank you. I know I speak for all of us to say that we are so grateful for the work that Planned Parenthood does every single day to protect access to reproductive health care. I am also grateful this morning to be joined by some of our great champions for reproductive freedom here in the Garden State. We have the Lieutenant Governor Tahisha Way with us, Attorney General Matt Plotkin, our Acting Commissioner of the New Jersey Department of Health, Dr. Caitlin Bastian, Acting Director of the New Jersey Division of Consumer Affairs, Carrie Face. We have from our rocking legislature, Trenton's own Senator Shirley Turner, Trenton's own Assemblywoman Verlina Reynolds Jackson. She's not from Trenton, but she loves Trenton and Hudson County. All the way in from Hudson County, Assemblywoman Angela McKnight. My best buddy and First Lady of the great state of New Jersey, Tammy Murphy. Kate McDonald is also here with Matt from the AG's office. Kate, nice to welcome you back into your former abode here. So today we are here with a simple message. New Jersey is, and New Jersey always will be, a safe haven for reproductive health care, period. We're going to ensure that our daughters do not inherit a world in which they have fewer rights than their parents did. And we're going to stand united in saying hell no to a right-wing movement that is hell-bent on ripping away our fundamental freedoms. As women across America continue to navigate the chaos created, as Jackie laid out, by the Supreme Court, the U.S. Supreme Court's disastrous Dobbs decision, the Garden State will not go backwards. We will stand firm. And to every woman who has been abandoned and targeted by their state's leadership, we are here to tell you, you have a home in New Jersey. Because here in our state, we believe that everyone is entitled to safe, affordable access to essential health care. And that same belief has guided all of us in our administration, and I might add, in our legislature since day one. You may have heard me say it before. As governor, among my top priorities has been establishing New Jersey as the single best state to raise a family, if and when you are ready to do so. Of course, this is one of the most intimate decisions imaginable. And the last thing that any woman, or any family for that matter, needs is some politician stepping in and dictating their ability to make that decision. Tammy and I have a dear friend who calls this government-regulated pregnancies, and that's exactly what we're up against. That is the opposite of freedom. And as elected leaders and lawmakers, our responsibility is to ensure that women and families can access every resource they need to make informed decisions about their own futures. That is exactly why over the past now nearly 6 years, our administration has made historic progress, again, working with outstanding legislative leaders in not only protecting but expanding reproductive rights. We have restored and increased tens of millions of dollars in funding for family planning clinics throughout our state, beginning with our historic step to refund, again, after 8 years of zero state funding. Think about that now. The prior administration zeroed out funding for Planned Parenthood for 8 consecutive years, claiming there was a budget crisis. I think, Paramel or Matt, what did we inherit? Like a $37 billion budget? They couldn't find $8 million in that budget 8 years in a row. We corrected that among our very first steps, and it's not just Planned Parenthood, but importantly, it is Planned Parenthood. We've enshrined the fundamental right to reproductive autonomy into law, again, as Jackie said, with the Freedom of Reproductive Choice Act. And we've also ensured that abortion services are covered by health insurance plans. And just earlier this year, we enacted a new law, which is why we're here, by the way, sponsored by, among others, Senator Turner, Assemblywoman Reynolds Jackson and Assemblywoman McKnight, and again, among others, Jackie listed them out, guaranteeing that every woman can obtain birth control from a New Jersey pharmacy without a prescription, even women who live outside of New Jersey. Now, when I signed that legislation into law back in January, I said it would take some time to implement as we put all the pieces into place. Well, today I'm honored to announce that we have taken a crucial step in turning this law into a reality. Earlier this morning, Kate, I'm told a unanimous vote, is that right? You were there? Carrie, you were there? I was not there. Okay. Turns out no one was there, but it was unanimous. Earlier this morning, the Board of Medical Examiners voted, I'm told unanimously, to establish a framework for our state's pharmacists to begin dispensing prescription-free contraceptives to women. And we have some of those very pharmacists with us today. Great to have you. You should know I do what Lori Clark tells me to do. We also have some great activists. I stand with Planned Parenthood. The pink shirts are with us as well. Let's hear it for you all as well. So for our aforementioned state's pharmacists to begin dispensing prescription-free contraceptives to women, and the Board of Pharmacy recently voted to advance the same framework. Now, there are lots of moving parts in this process, so I won't dig into all the details. But I will say is that starting next year, do we think spring? Is that a reasonable time frame? Somebody? Why not? Let's say June. It's like, I feel like I'm in an auction house. Do I hear spring? I heard June back from Kate. Sometime in the first half, we're hoping, of next year, any woman will be able to walk into a pharmacy in New Jersey and buy birth control without a prescription if it is medically appropriate, period, full stop. And again, that applies to every woman, whether or not they live in the Garden State. Now, while this is a big deal, frankly, it should not be. After all, roughly 9 in 10 women, as Jackie said, say they've used some form of contraception in their lives. So the idea that any politician would try and make it harder for women to access this essential form of health care is patently absurd. But tragically, that is the agenda being advanced by some extremists. I don't want to be political, but they're in the Republican Party. And they're not content with just coming after abortion rights. They want to come after every reproductive right. By the way, this includes some members of the U.S. Supreme Court, I might add as well. Every right from making family planning services less affordable to barring access to birth control and or IVF. And as I said a few minutes ago, you have our word. The anti-choice agenda is dead on arrival in New Jersey. And with the help of everyone here today, we're going to continue making family planning services more affordable and accessible through community resources like Planned Parenthood or federally qualified health centers or independent family planning providers or hospital-affiliated clinics or others. In short, New Jersey is moving forward in protecting reproductive freedom in every way, shape, and form. By the way, before I turn this thing over to our great Lieutenant Governor, there are some out there, they say this, it's hard, it's unfathomable, who say that when we talk about reproductive freedom and rights and abortion and birth control and contraception, that we're distracting from the real issues, that we're changing the subject. My God, these are the real issues. These are fundamental freedoms for women in America and more broadly for families and for all of us in America. This isn't changing the subject. This is the subject. With that, please help me welcome my partner in government, an extraordinary leader, the First Lady, the Lieutenant Governor. First Lady's my partner in life, by the way, more on her in a moment. The Lieutenant Governor of the great state of New Jersey, Tahisha Way.
Okay, good afternoon. And before I begin, I just want to sincerely thank our great governor and First Lady for their leadership on this issue. Now, I am going to get right into it because I know there is a fantastic lineup of speakers. I am truly honored to serve as New Jersey's Lieutenant Governor and Secretary of State. But most importantly is my top job as mom. Now, as a parent, you want the very best for your children. You raise them to be thoughtful, independent people who will make good choices for themselves. You teach your kids right from wrong. You let them know that they can be and do anything. You remind them that there are no limits whatsoever to what they can achieve. And yet, as a mom of 4 daughters, I worry every day that they are growing up with fewer rights in this country than I had at their respective age. I am concerned that we, as the governor noted, are going backwards, losing the freedoms that women in my generation, my mother's generation, achieved. Folk, we cannot go back to a time when we didn't trust women and people to make personal decisions without interference. So, like the governor just said, this morning, we are making it absolutely clear New Jersey is not going backwards. While other states are taking away rights, making it harder to access reproductive health care, our state says no. We will do everything in our power to make reproductive care more accessible, more affordable, for every single family. Here in our state, we listen to women and we trust women. And that's why today is a great day as we hit this important milestone in our efforts to eliminate barriers to accessing reproductive health. We want people, especially those who are young, who are vulnerable, to know that New Jersey is a safe place where they can make their own medical decisions, again, without any interference. Now, I look forward to turning the page to 2024, when every woman, whether or not they live in the great state of New Jersey, will be able to walk into a pharmacy and purchase contraceptives without a prescription. And I look forward to continuing to work closely with all here to protect these sacred reproductive rights to all. Thank you, and onward.
I was just making sure I have my dates right. Tahisha, thank you for that, both as Lieutenant Governor, as a mom, most importantly, and, which brings me to a quick sidebar, as Secretary of State. I don't care how you vote. I probably do care, but I can't say that I care in the State House. But please vote, folks. Deadline to register is October 17. Mail-in ballots are distributed. Early in-person voting, which we started a few years ago quite successfully, beginning Saturday, October 28. And that runs every day through Sunday, November 5. And then they take the day off on Monday, and then game day is November 7. And please vote, everybody. And I say all that because I want to give a shout out. Tahisha's been Secretary of State for going on 6 years, and it's not like she's been able to put her feet up. We've had among other things, a pandemic and an assault on democracy. Other than that, it's been smooth sailing. But New Jersey's voting record through that, whether we won or lost elections, doesn't matter. It has been impeccable. So I take my hat off to you in that respect as well, and thank you. Moving right along, I mentioned her a minute ago, and I'm thrilled that she's here. She has been a leader, particularly in the arena of equity as it relates to maternal and infant health. Please help me welcome the great First Lady of the great state of New Jersey, Tammy Murphy.
Slightly shorter. Thank you, Phil. Listening to the prior remarks, I am focused on the fact that across the country, a woman's autonomy is under attack. Our freedom to make our own decisions about our own intimate affairs, as Phil said, if and when we want to start a family, is shrinking. I remember those awful feelings of frustration, disappointment, and hopelessness after the Supreme Court overturned 5 decades of precedent to end a woman's constitutional right to govern her own body. The justices essentially said to women, your choices do not matter. Your future is not yours to decide. But I also remember the incredible outpouring of support, the chorus of voices, voters, and activists who said, yes, our choices do matter. Our future and our bodies are ours to control. I am deeply proud that New Jersey has been part of that chorus, reaffirming our fundamental rights to reproductive freedom and autonomy. Here, we believe that the decision on whether and when to start a family is a personal one. But it's not enough to say we believe it. We also act to ensure every woman can actually make those decisions for herself. That is why I am so proud of the actions Phil, the legislator, and all of our allies have taken since day one of this administration to make family planning as accessible and affordable as possible. As Phil said, we restored funding to the state's family planning clinics, which help women regardless of their ability to pay, and expanded the program to reach even more women. We ensured women have insurance coverage for abortion services, and we expanded access to prenatal and family planning services to undocumented women. And I was really proud to stand with Phil when we codified women's reproductive rights into state law, so every New Jerseyan has the right to make their own decision about their body, their life, and their future. And today is the latest in that long line of actions to expand reproductive freedom. Next year, any woman will be able to walk into a pharmacy and take control of her future by getting birth control. And she will not have to depend on a doctor to get a prescription. As Jackie has said and Phil has said, and I think it merits saying 3 times because you might remember it, that matters because 90% of women have used contraception in their lives, and more than 60% of women are currently using some form of it. Yet the United States is one of the few countries in the world where women cannot get over-the-counter birth control pills. That makes it particularly difficult for women who are already vulnerable, like students, immigrants, people of color, people with low incomes, members of the LGBT community who may not find it easy to see a doctor to get a prescription. So this will benefit them and women across New Jersey. But a woman's autonomy is not just about reproductive freedom. It's also about economic freedom, freedom from discrimination, freedom to live a healthy life, and more. That is why, with the help of our legislative partners, Phil signed laws that require equal pay for equal work, guaranteed paid sick leave, expanded family leave, and a higher minimum wage. And we are committed to making New Jersey the safest, most equitable place in the nation to give birth when you're ready to do that. As First Lady, one of my most urgent priorities has been tackling the maternal and infant health crisis. But maternal health, rights, and justice do not exist without reproductive health, rights, and justice. The two cannot be separated, as they are core elements of women's health. We want the next generation of New Jerseyans to inherit a state that proves without question that when women are healthier and have more economic freedom, we all do better. That is the future that we are building right now. Thank you so much.
Tammy, thank you, and thanks for your leadership on this whole arena. I'm going to call up Matt Plotkin in a second, but I want to say that Matt is the senior member of our administration of Jewish faith, and this has been a devastating week, I know, for him and his family, and he has spoken eloquently, and I'm sure he'll be called on to speak eloquently other times in the days, weeks, and months ahead. Beyond that, he's an extraordinary colleague and an extraordinary Attorney General, and he is a vital and central player in the defense of freedoms and rights in this state. Please help me welcome our Attorney General, Matt Plotkin.
Good afternoon. Thank you, Governor, for those remarks. And before I begin, let me just thank you and the First Lady and Lieutenant Governor and everybody for the outpouring of support and the leadership you've shown this week. It's been a tough week, I think, across the state for a lot of people. And I want you all to know that we still currently have no credible threat against any community in the state, which is a good thing, and we'll work extraordinarily hard across state and federal partners to make sure that folks stay safe, and we will continue to provide additional support, particularly around our houses of worship and particularly around the large-scale gatherings we have. And I would repeat what I've said all week to anybody who feels unsafe for whatever reason. Please don't think that information is too insignificant to report. You can tell your local police. You can tell us through our website, bias.njcivilrights.gov. We take every piece of information seriously and look at it from every possible angle. So please continue to do that, and we'll stand with everybody who is out feeling a lot of pain right now. But thank you again to Governor Murphy, Lieutenant Governor, First Lady, to our legislative leaders, who I'll touch on more in a second. But thank you for convening this really important event at a time when access to reproductive health care, whether that is contraception or abortion, is being challenged in, frankly, unprecedented ways across the country. Just 2 weeks ago, the elected county commissioners of Cochran County, Texas, voted unanimously in favor of an ordinance that bans travel on its local roads if the purpose of that travel is to seek an abortion. The goal of that ordinance is to stop travel between Texas and neighboring New Mexico, where abortion remains legal. Now, some of you know I have an 8-week-old at home, and I told my wife, 8-week-old daughter, and I told my wife that I was going to share that story, and she told me I have to tell the personal story about our family that relates directly to that. And when, as Jackie mentioned, when your wife's in the 4th trimester, you listen to what she says. So we were expecting our second child when Dobbs was handed down, and my wife's from Texas, and every summer she goes back for 2 weeks to take care of her parents. And we had a checkup 2 days before she was scheduled to get on the plane, and we found out that we lost that child, that pregnancy was not viable. And the options were to wait 2 weeks for her to come home, or to have the procedure in Texas, which is what those were the options we were given. She could have been criminally prosecuted had she had that procedure in Texas. So I was sitting there as the chief law enforcement officer of the state of New Jersey, and I will tell you, I was personally grateful for the protections that the legislators, the governor, and so many others have put in place that benefited my wife and our family, and we were able to get that procedure before she had to take that trip. But you think about how many women are in that position in states that don't have these protections. Trust me, it hits home in a way that I think it does for millions of women and families in New Jersey and across this country. Now, I will say, fortunately, that ordinance is very likely unenforceable, but it's an ominous sign of what is to come if we don't take every opportunity now to protect reproductive rights across the board. We've reached a point in this country where reproductive freedom and freedom of movement is being challenged by, as the governor said, extremists attempting to stop those from seeking reproductive health care that they need including from stopping them from traveling from one state to another. I never expected to see such draconian restrictions looming in our nation, but I can tell you that in New Jersey, thanks to the leadership of all of those who are here, we are committed to protecting your personal freedoms, and that the most basic of rights, the right to decide when or if you will have a child, will be protected. With the overturning of Roe v. Wade, the historic overturning of 50 years of precedent, first time ever the Supreme Court ever revoked a fundamental right, our current United States Supreme Court has made it abundantly clear that the rights of women will not be protected by our highest court in the land. But protecting reproductive rights is a priority for this administration, for the governor, and we will always stand up for the women of New Jersey and others who come here from states seeking reproductive health care. In January of 2022, the state legislature enacted and Governor Murphy signed into law the Freedom of Reproductive Choice Act. As the governor said, that law codifies the fundamental right to an abortion in New Jersey. That is the law of the land. As a result, there is no doubt that the right to reproductive choice in New Jersey is protected. After the Supreme Court overruled Roe last year, my office took a series of steps to protect reproductive rights and to educate providers and the public on the protections they have in our state. We created a reproductive rights strike force. The strike force, which is comprised of multiple divisions from within my department, the Department of Law and Public Safety, works to protect access to reproductive health care and abortion care for New Jersey residents, as well as anyone traveling to New Jersey to access such care. We developed a state and federal partnership with the United States Attorney's Office for the District of New Jersey to ensure access to reproductive health care and to hold accountable those who would interfere with that right in a way that violates both federal and state law. This partnership is the first of its kind in the country. This partnership also ensures that state-federal collaboration occurs to protect healthcare workers. It increases security for providers of abortion care who are at risk, and it provides the data privacy rights, protects the data privacy rights of patients and those who assist individuals seeking reproductive health care services. With respect to consumer rights, which are incredibly important right now, we've issued Know Your Rights documents. I want to thank Acting Director of Consumer Affairs, Carrie Fayes, in the form of a series of Q&As to help anyone living in or visiting New Jersey in clear terms to understand their rights. Please visit our website and see those if you're having any questions. We've also issued guidance to healthcare providers, to medical boards, and the public to safeguard the privacy of reproductive care patients and providers in New Jersey need in order to take advantage of the services that are legal here. And we've issued consumer alerts warning the public, and this is important, about crisis pregnancy centers. These are organizations that seek to prevent individuals from accessing abortion care and often violate our laws. On the technology front, in November of 2022, New Jersey led a multi-state coalition expressing concerns to Apple regarding reproductive health privacy on Apple's App Store. We've urged Apple to take common sense steps to protect consumers' private reproductive health care information and to take an appropriately broad view of what that information is. Not just the narrow view of the healthcare data itself, but as Texas shows, the location data about where people are traveling so that it cannot be used in a way to, God forbid, prosecute someone for taking advantage of what is lawful in states like New Jersey. That effort is ongoing. Kate has been leading in. I'm really grateful for her work. Last year, thanks to the governor and the legislature, we announced $5 million in grant funding to support abortion and reproductive health training and education. Once again, thanks to the governor and the legislature, that funding will be made available again this year. As we all know, anti-choice activists have not stopped in fighting to restrict access to reproductive rights since Roe was overturned. Earlier this year, my office joined over 20 states. We worked closely with Jackie on this, in supporting the abortion pill mifepristone's legality against the emergency challenge in the Texas District Court and through subsequent appeals. Once again, I keep saying this, an unprecedented legal decision. Following the Texas court's decision to invalidate the FDA's 23-year-old approval of mifepristone, I tasked the Director of the Division of Consumer Affairs to convene the relevant professional licensing boards to provide clarity to thousands of medical professionals across the state. I'm grateful that the boards of medical examiners, nursing, and pharmacy all said that and voted unanimously that any healthcare practitioner in New Jersey who continued to prescribe, dispense, or administer mifepristone would not be subject to professional discipline while the legal status of the pill is in flux, and that continues to be the case today. And most recently, our Board of Medical Examiners, which oversees midwives, proposed a rule that would establish the regulatory requirements for certified nurse midwives and midwives to perform surgical abortions through the 14th week of pregnancy. This follows action by the Board of Medical Examiners in December of 2021 when they unanimously approved the elimination of medically unnecessary restrictions and cleared a path for advanced practice nurses, physician assistants, as well as midwives to perform early aspiration abortions. Again, expanding access to what is lawful in New Jersey. And our work isn't done, which is, I know, why we're here. As our governor has mentioned, important work is happening even as we sit here. The Board of Medical Examiners today joined the Board of Pharmacy in unanimously approving a protocol that will eventually allow pharmacists to dispense contraception without a doctor's prescription. I want to thank our legislators who are here. I spoke to Senator Turner, who introduced this bill, I believe, 8 years ago for the first time. This has been a long effort. The assault on women's rights and reproductive health in New Jersey and across the country, unfortunately, is ongoing. And as long as there are those who would attack those rights, I know that Governor Murphy, Lieutenant Governor, First Lady, this administration, and our legislature will continue to pursue every means of protecting them. Thank you.
I just said to Matt, very powerful. God bless your wife, daughter, and son. One of the takeaways from that Texas story, and we've said this before, and I won't go on because I know we've gone on already, but we are now a patchwork quilt country. It really matters where you live, where you work, and it turns out where you visit, where you go to college. Increasingly, this is coming up, young women in particular assessing where they go to college. And the break points are typically a collection of items. Reproductive freedom / abortion would be at the top of that list. Guns and gun safety, voting rights, Tahisha, treatment of the LGBTQIA plus community, the environment. Those would probably be the big five, but there are more, unfortunately. None more so, I think, than what we're talking about today. And Tammy points out increasingly, and Matt, you'll and Kate will, I think, attest to this. If you're in a medical school in a state like Texas or Tennessee, where I was at a conference on Sunday, or I'll bet you if you're a pharmacist in those states, you're no longer either allowed to do something or alternatively you could be prosecuted for doing something. So you've got medical schools, to pick that example, where reproductive health care is not being taught in a vast swath of the states in America right now. Not being taught. So it's now going to matter not just where you but also where you choose to live based on whether or not there's technical expertise in that state. And I'm happy to say as a New Jerseyan, we're on the right side of all that, but I say that as an American with a very heavy heart, that you can't say that about our whole country. Sorry to make me riff. Please, I've mentioned her already. We're thrilled to have her on the team, a new member, but somebody who we were just absolutely thrilled to convince to join us. Dr. Caitlin Baston is our acting commissioner, of the New Jersey Department of Health. Caitlin, come on down.
Thank you. What an incredible day. I will tell you all, as a family medicine physician, I could not be more proud in this moment to be standing here with you in this state as a leader in protecting reproductive access and health and rights, as so many people have talked about already today. I was fortunate to be able to train in full spectrum family medicine, right? And I had such a different experience than, unfortunately, as the governor just mentioned, so many people will get today. And this leap that we're celebrating today, just another step, allowing contraceptives, hormonal contraceptives, to be bought at a pharmacy without a physician's prescription or anyone's prescription, is a huge step because it's furthering this, right? Without access, there is no choice. If patients can't access these medications, these day-to-day safe medications, they actually don't have a choice about when or how they decide to become pregnant. And I can't tell you, as a practicing family physician, how many times I unfortunately had to counsel and sit with families after they had undesired pregnancies, and through tears and fears of whether or not they could survive that pregnancy or their family could survive that pregnancy, all because they didn't have transportation to get to an appointment, or they weren't able to take a day off work, or they had childcare issues, or they couldn't get in to see a doctor in time, and then they end up pregnant. Access to contraceptives protects rights. It protects rights of people who can become pregnant by empowering individuals to make informed decisions about their health. At the Department of Health, I've been very excited to be able to partner on this and to establish standard procedures for pharmacists to safely prescribe these hormonal contraceptives, so that we're not just demonstrating that we can support individual access and empowerment, but that we can do that safely while protecting individual rights and privacy, as was mentioned. Access in pharmacies will build upon the progress that we've made over the past 6 years, as we also talked about earlier. The Department of Health proudly works with the New Jersey Family Planning League and providers like Planned Parenthood to ensure that contraceptive care and counseling are available at clinics in every county across our state, regardless of someone's ability to pay. Family planning providers deliver critical primary and preventive health care. This is the foundation of a healthy New Jersey, why we're here and why I'm happy and proud to be here today. We are committed, the Department of Health is committed to raising awareness about this expansion of reproductive health services in partnership with the Governor's Office and the First Lady and the Attorney General's Division of Consumer Affairs. Because today is about celebrating. We are going to shout from the mountaintops that people can get access to over-the-counter or at a pharmacy without a prescription hormonal contraceptives. And we're celebrating the autonomy, right? That individuals can be empowered to make this decision for what they need, what they know they need to take care of themselves. So thank you.
Caitlin is well on her way to becoming the next Department of Health woman who needs no introduction. Thank you so much, Doctor. Deep thanks, and you live this reality in your whole professional life. So with all due respect to all of the rest of us, today doesn't happen unless a bill gets championed in both houses and gets to my desk for signature. And that's exactly what happened. And we have several of the leaders here today, and I'd love to ask two of them to come on up and say a few words. And again, I cannot thank them enough. I can't tell you how many, I don't know what the toll is up to, Shirley and Verlina and Angela. And Verlina's going to speak on behalf of the Assembly, so Angela's here as a witness. But how many events have we done together, overwhelmingly directed at equity? And no community speaks to that, and no leadership does more so than what you all do in the capital city right here in Trenton. Please help me welcome an extraordinary leader, Senator Trenton's own Shirley Turner. Congratulations and God bless you.
Good afternoon, everyone. This is more than a good afternoon. This is a great afternoon. All I can say is thank you, thank you, thank you all for being stakeholders and being people who realize the importance of providing rights for reproductiveness to women. This is oh happy day. I thought we had freed the pill in January, but I guess we have to wait to free the pill until 2024. But I know that it's going to make a great difference in the lives of so many women and families in the great state of New Jersey, because we will be joining 20 other states as well as 100 other countries and allowing women to access birth control pills over the counter without a doctor's prescription. And it makes so much sense because it can take not just weeks, but months to get in to see a doctor. And how many women will have unwanted pregnancies waiting to get to see a doctor for a prescription? When we know with pharmacies, there's one, in many cases, two on every corner in so many communities. And not only that, many of them are open 24 hours a day, so you won't run the risk of missing a pill because you could not get a prescription. So I want to thank one and all for what you've done and for your perseverance and allowing New Jersey to be in the vanguard of providing more rights for reproduction to women, and also for allowing women to gain access to contraceptives, because we know the basics are women are responsible for planning families. It falls squarely on their shoulders in most cases, even though it takes two to tango. But women are ultimately the ones who make those decisions. So thank you so much for your leadership, Governor, and all of your administration, and to Planned Parenthood, who's been there every step of the way. And thank my colleagues in the Assembly, particularly Assemblywoman Reynolds Jackson, for getting that bill passed in the Assembly, along with Assemblywoman McKnight. And I want to also thank the co-prime of 275, my senator colleague, Joe Vitale. So there are so many of you who have made this day possible. So I know that in 2024, New Jersey is going to be a better state for women and families. So keep on keeping on. We have more to do until we eliminate all of the barriers that prevent women from getting reproductive rights in this state and in this country. Thank you.
Senator, thank you again for your words and your leadership. And one other, we've got some of the best doctors in America, if not the world. But one other element I was going to mention earlier, you mentioned, well, it could take you a while to get an appointment. Those appointments also cost a lot of money. So we're cutting out not just a step in the process, but a financial burden in the process. So thank you, Senator. Last but certainly not least, and we wanted to make sure we gave everybody a voice here, because this touches a lot of different perspectives, and importantly, it touches our General Assembly, and I could not be more proud to stand with. Please help me welcome Assemblywoman Verlena Reynolds Jackson, Trenton Zone. God bless.
So I'm so pleased to be here today with you all in supporting my great senator, Senator Turner, who is a change agent champion. And you heard it before that she's been working on this bill since 2018. But you want to talk about resilience. Every year you have to go back in, you have to file all over again. And the governor's point, we need to have it passed in both houses. But look at the great work of government here. Look at the interagency work that we have going on here. Look at the layers of making sure we have the community voices here. These are all people that we couldn't do without them. And so I want to thank the Board of Pharmacy. I want to thank the Board of Medical Examiners for voting through a new rule to implement our legislation. I want to thank the governor for being a partner and working with us to uplift reproductive rights, to avoid unwanted pregnancies and to give individuals and families more control over when and if they choose to have a child. We're expanding access to hormonal contraceptives by implementing pharmacists to dispense contraceptives without a prescription from a healthcare provider. I take immense pride in this unwavering commitment to uphold women's reproductive freedoms in New Jersey. This is more than just a policy stance. It's a fundamental belief that empowers women to make sure that they can take care of their own selves and their own choices. Over the past year, I've heard many heart-wrenching stories that have come across our nation's radio waves, internet, and all types of things. Stories about families suffering and women placed in impossible situations because of the post-Dodd laws enacted nationwide. But they can't just be stories. These are real people. These are real lives being forced to pay the consequences of a decision they didn't even make in their own state. Implemented dangerous restrictions on their health care and their health care services. People should always have the right to choose what is best for themselves and their families. While many states across the country work to block access to health care, New Jersey has emerged as a leader in preserving reproductive rights. It's been an honor to take advantage of this key legislation, and as we said, we're going to cheer this on from the mountaintops. It is our turn as a state to be a safe haven for those needing care. Today's announcements furthers our work to ensure that all New Jerseyans have the power to decide their present and their future. We know starting a family is a big decision. This will truly have a difference on our communities. And I'm tremendously grateful again for all of the interagency work, because access to birth control is not a luxury. It's a basic health care need and a human right. And so thank you all for your support today. I look forward to coming back in June when the pill is free.
Going to start putting T-shirts on, free the pill, or we freed the pill. Thanks to everybody here. Tammy just reminded me our daughter's running the New York City Marathon, and you have a whole list of choices of organizations to raise money into, and she chose Planned Parenthood, Jackie. I also want to say, since we moved to this new media room, our flag budget has clearly expanded. We used to have one of each, and now I feel like we've come into the big time here. So to our extraordinary legislators, Shirley, Verlina, Angela, thank you so much. We wouldn't have been here today without you. Matt and Kate from the AGs, thank you for everything. Jackie, to you and the fellow Planned Parenthood activists, Caitlin, Carrie, Lieutenant Governor Tahisha Way, First Lady, Lori and the pharmacists. You could go on the road with that group, Lori and the pharmacists. It's a big day. We're not quite there yet, but now this is purely execution. This is no longer we need this vote or that vote. Thankfully, we're through the legislature. I've signed it. The respective boards have voted on it. It's complicated, so we got to make sure we do it right. But it's coming at us in a matter of months. And again, we will be the state, I promise you, as long as we're around here, and I suspect for a lot longer after that. We will defend reproductive freedoms, reproductive health, rights to abortion, contraception, birth control at all costs. Thank you all.